Hi, today in this video I'm going to talk about whooping cough. Whooping cough is actually one of the bacterial infection. It's caused by bacterium Bordetella pertussis. So it can actually affect people of any age, but quite often it doesn't really do much harm to people between age 10 to 70. However, it can be a life-threatening event for babies and young children. In Australia, we usually have the epidemic every 3 to 4 years. So one of the big problem is the immunity for the pertussis is actually not lifelong. So that's why we can actually get reinfected every time. Whooping cough may start like a cold symptom, such as sneezing, runny nose, and tiredness. But after that, they may develop the irritating cough. So quite often they start with the severe kind of the very violent cough, followed by the high pitch of the whoops cough. So the reason they have the whoop cough is because they try to catch the next breath. Especially for children, this quite often will obstruct their airway and cause them not be able to breathe. Prevention remains the most effective way. So for our Australian National Immunization Program, so we actually are very lucky that we get vaccinated with the whooping cough vaccination. However, for infant or newborn baby, they wouldn't get the vaccination until they're 2 months old, followed by 4 months old and 6 months old. Then after that, they will get a booster on 18 months old, followed by a booster on 4 years old. So that's why within the period of newborn until 2 months old, or sometime up to 6 months old, they basically is the vulnerable to the whooping cough. One of the important fact that you need to remember is the booster of the whooping cough, sometimes they may last up to 10 years. So we are lucky that in school, so we will have the booster on 4 years old. Then after that, the school-based immunization program normally will give us another booster on 11 to 13 years old. But the time period may be different in different states. So which means when you are 11 to 13 years old, we will get another booster which can last for 10 years. So which means when we are 21 years old or 23 years old, quite often we will not be covered by the whooping cough vaccination anymore. So in this particular time, let's say you had a baby or you are going to have a close contact with a baby. So this time that is very important for you to get another dose of the booster in order to cover yourself, which means that not to pass it on to the baby. Who should actually get the booster dose of the whooping cough? So firstly, is pregnant ladies, like the mothers to be. So the optimal times to get the booster vaccination for the whooping cough is around the 2nd trimester until the early of the 3rd trimester. If let's say you didn't get any booster of the whooping cough before you give birth to the baby, just go to see your GP as soon as possible and get a dose of the vaccination done. Secondly, of course, is the fathers to be or grandparents to be. So you make sure you get the vaccination done 2 weeks before you have the close contact with the infant. Other than that, will be people working with the children or the infant, like healthcare worker like me. So basically, we need to get our the whooping cough booster done every 10 years. So let me recap. So remember, whooping cough is a bacterial infection. So they are actually cause quite a serious infection. Sometimes can be life-threatening to the baby, infant, and up to 10 years old. And for those booster, they only last for 10 years. So plan well and get your booster done. If let's say you can't remember when was the last dose that you get it done and you are having another a baby, so just get it done. Thank you.